the goal here is to provide the latest information that we have about important issues with COVID and testing, vaccines, the data that we're seeing, and then importantly to take your questions. And we will get through as many questions as possible. You know, I think we all understand that it's incredibly important to be taking seriously the health and well-being of ourselves, our families, our community. And I am honored to have joined with us some representatives of the health institutions that are part of the team of keeping us safe. And so would like to start with our Public Health Director, Michele Desmarais.
Good evening, everybody. I'm just going to give a few statistics of the state of COVID in Lynn, and these statistics are from January 15th. So the total amount of one-dose vaccines, and this is the total amount of people who have had one vaccine, one dose, 80,104. The total amount of fully vaccinated people are 70,206. I think it's important for everybody to, when I say fully vaccinated, that I mean that you've had 2 doses, whether you've had 2 doses of Moderna, 2 doses of Pfizer, and 1 Johnson & Johnson. And total amount of boosted residents. Boosted residents means that you are up to date, that you've had your 2 Modernas, 2 Pfizers, and a booster shot. The total amount of boosted Lynn residents as of January 15th is 24,121. The total amount of tests that were conducted, that were taken from data between January 2nd and January 15th is 18,668. And Lynn at that time has a positive test rate of 30.92% positive. Mayor Nicholson.
Thank you, Michele. Un momento para recordarles si necesita traducción en vivo. Tenemos una opción al fondo de pantalla para seleccionar la traducción en vivo en español. Gracias. Just want to remind everyone about the translation option that's down below. So thank you, Michele. We are also honored to have doctors from Lynn Community Health Center and North Shore Medical Center. If we could just take a moment to introduce yourselves and let us know where you're joining us from. We can start with Dr. Valdes.
Hi, I'm Dr. Christine Valdes from North Shore Physicians Group and Salem Hospital, and I'm a family doctor there.
And Dr. Vandenberg.
Hi, everybody. This is Dr. Lambl. I'm from Salem Hospital, and I'm honored to be joining you tonight.
And this is Dr. Clark Vandenberg. I'm a family doctor at Lynn Community Health Center. And
thank you, Dr. Vandenberg, joining us from Lynn Community Health Center, and I'm sure had a bit of a connection issue. I think there he is. Yeah. Okay.
Yeah, sorry. Yeah, this is Dr. Clark Vandenberg. I'm a family doctor at Lynn Community Health Center and proud Lynn resident. Happy to be here.
Thank you, Dr. Vandenberg. So just wanted to remind everyone that you can start posting your questions, and our team will be collecting those. And so when we finish the presentation portion of the evening, we will be running through those. So please start posting your questions as well. So having started with the snapshot of where we are as a city from Michele Desmarais, our Public Health Director, we wanted to talk a little bit more about where the community is in terms of thoughts on what our needs are. And so we've worked on developing a survey to reach out to the community to get a sense of what people's focused on in terms of issues. And I'm very grateful for all those who participated and are sharing the results of that here. You can see that obviously people are worried about getting sick. People are worried about getting their family sick. People are worried about, the general sense of anxiety. And in terms of actual sort of tactical issues that people are having, there's a big focus on access to COVID testing. That was one of the top issues you can see in the top left there. That while people feel like there's access to it's less common to see people have an issue with access to vaccines, the access to testing is a top issue. And the following questions in terms of how easy it is for people to access, you can see that the access to vaccines have a much higher percentage of very easy, somewhat easy, than both the PCR and the access to home tests, the rapid antigen tests. So we appreciate people sharing that feedback and have taken it to heart. I think we wanted to take this opportunity to remind folks of where those vaccines are that are in the City of Lynn. So this presents 4 options that are exist in the city through ourselves and our partners. Lynn City Hall, Fridays and Mondays, North Shore Community College, Wednesdays and Thursdays and Saturdays. You can see the exact times below there. The Lynn Community Health Center with Lynn Community Health Center patients. And then the Mass General Brigham has partnered with the Brickyard Collaborative for Tuesday afternoons, providing access. So the other important note here is that for people who have mobility issues who can't get to those vaccination sites, there are options if you're homebound that number you can call to schedule the vaccine, and we encourage you to do that and to remind your neighbors as well. So moving on from the vaccines, the PCR tests, and I think we'll have a chance to get into this more with the experts about the PCR versus the rapid antigen test, but PCRs tests are still considered the gold standard of the actual results of the test. And so this is the availability of where you can be scheduling PCR tests. There's the Stop the Spread Project Beacon site on Blossom Street. North Shore Community College is offering those tests, and the Community Health Center as well. We understand and recognize, and this was the takeaway from our survey, that people are having really difficult time accessing these tests. Anecdotally, our understanding is that is improving as the demand for tests has started to subside. So we would encourage you to continue to monitor that. So that was a PCR test. For the home test, the rapid antigen test. There are more and more ways for people to obtain these, and more efforts to make these accessible. I think an important one is that they're available over the counter, and we would encourage you to check with your health insurance provider, because a lot of insurers are covering these tests and reimbursing you, so that you can get a rapid antigen test and then submit for reimbursement from your health insurer. The federal government has made 4 tests available for each household, and that's the website there, the covidtest.gov, and that is something that's available to every household to get it up to 4. We recognize that there is a continued need for these, and so with the support of the City Council, we have worked to put an order in for about 50,000 kits. There being 2 tests in each kit, so close to 100,000 tests that we're going to be working on distributing once those are available. As all of you probably recognize, there's issues with the supply chain and getting these, but our team is working as quickly as possible to get these and put these in the hands of folks that are otherwise having a harder time accessing them. And then the last option for the app antigen test is for the Lynn Public Schools. So students in Lynn Public Schools, as well as staff, have the opportunity to participate in a new antigen testing program through the Department of Elementary and Secondary Education, where people will receive 1 test a week, 2 kits every other week, so 1 test a week. Those are something that our students and teachers are starting to take advantage of. The pool testing for parents, the pool testing is going to be continued to be happening at the elementary school level, but also in addition to these the antigen tests they're going to be offered. So that's the availability of testing. I'd also like to welcome Dr. Lambl from the North Shore Medical Center, who's joined us by phone. Dr. Lambl, are you with us?
Yes. Good evening, Mayor. Good evening to all the folks, the good folks of Lynn. My name is Barbara Lambl, and I'm an infectious disease specialist at Salem Hospital and formerly of Lynn Union Hospital. Thank you. It's an honor to be here.
Thank you so much, Dr. Lambl. So I'd like to turn it over now to Dr. Lambl and Dr. Haptu to talk to us a little bit more about what they're seeing as far as the course of the pandemic and where we are and what we're looking
at. Sure. I can start us off here. You all have probably heard on the evening news or heard rumors that COVID-19 is starting to go down. The rates are going down. But I'd like to put that in a little bit of context. Across the state, our state of Massachusetts and on the East Coast in some of the major metropolitan areas, yes, there have been some dips over the last 2 weeks, the last 14 days. But I want to put that in perspective because here locally in Essex County, I don't see that happening quite as dramatically as in some other parts of Massachusetts. Remember that when you look on the Massachusetts.gov COVID website dashboard, what you see is a 2-week running average for the whole state. And there are some parts of the state with very, very little COVID infection rates. And then there's the eastern coast where we've been hit really hard. And I would just like to reiterate something that Director Desmarais pointed out, which is that, we're still seeing a lot of people testing positive in Lynn. 31% of all people coming to be tested are positive right now as of today. And that is 30 times higher, folks, 30 times higher than it was in July. So Omicron has hit us really, really hard. And we're not quite, we haven't quite turned the corner yet on this virus.
Dr. Haptu, I think you're on mute.
Sorry. Good evening. Thank you very much. I feel very privileged to participate in this webinar and to educate a little bit the beloved community of City of Lynn. So in addition to what Dr. Lambl said, basically overall, there's a trend in the East Coast, which is they said that east of the 95 corridor and the New England, and then even some parts, even down south and Mississippi and Memphis, Tennessee, there is a little trend of downward. It depends where you are, but there are areas also that are still high. And for example, they say in the Chicago area, in the Philadelphia area, where the teachers had a higher between, Christmas and New Year, there was a high from 20% to 2%. So there is kind of a light at the end of the tunnel, but we can't just blanket that like what Dr. Lambl said. There are areas that are still raging.
Thank you so much, Dr. Haptu, Dr. Lambl, and of course both of them as well as our other partners will be here to take questions and would just like to remind folks to please continue to submit questions, get your questions ready, because that's a big focus of this evening for us to be able to answer your questions. But again, thank you, Dr. Lambl and Dr. Haptu. I think as you just heard, there's certainly a lot to continue to be concerned about, to address. But as Dr. Haptu said, there is starting to be light at the end of the tunnel. We do see some encouraging trends, even though this is still very much an ongoing issue that we need to continue to be vigilant about. One of the goals of this evening was to update folks and get, as we've continued to get people's feedback on some of our options here in the city. As people know, we as a city, the city leadership, partnering with the previous administration, Mayor Tom McGee, have been thinking about different options in terms of things we could do in consultation with myself when Mayor McGee was in office. The mask mandate was re-implemented, and then we also decided to take a look at doing a vaccine passport, similar to what the city of Boston is doing and the city of Salem has done. And while we are very supportive of what our community partners are doing in Boston and Salem and applaud their efforts there, I think the thinking of where our team is in the city is that one of the main goals of a vaccine passport is to help folks get incentivized to be vaccinated. And one of the things that we've been really paying close attention to is our vaccination numbers. And, you know, unlike I think other communities that potentially have felt like they had hit a plateau in the vaccination rate, our vaccination rates continue to increase. And I think we have some of that data here that I'd like to share and point out. And that's a result of some really strong work, I think, from our public health team, our community partners, that you can see here that there's been a real steadily increase since this summer that has continued through the Omicron surge. And that's something that we're really excited about because ultimately this is what's going to allow us to move forward as we get the community vaccinated. And there's a lot of work to do to continue that progress, but I think our feeling is that that is the appropriate focus area for our progress as we continue to see those numbers move in the right direction. And we certainly ask for all of the community's help in continuing to answer people's questions, make sure that the availability is there, the accessibility is there, and we continue to make a difference by building up our collective response to this by getting folks vaccinated. And that combined with the fact that the way that Omicron has played out, we see that as the right focus area. And of course, you know, you can certainly remember that if you are planning to go to Boston or to Salem, that you are going to need to show proof of vaccination. So again, we appreciate the activity that our partners in sister cities have taken up here. So that's where we are on that. And I would like to turn it over to Dr. Vandenberg from the Community Health Center to talk through sort of how do we go forward? What are we doing now? How is this impacting our day-to-day life that we can get through this? And thank you so much, Dr. Vandenberg, for joining us.
Yeah, thanks, Mayor Nicholson. So a lot of these things that we're going to be talking about are not necessarily new, but we did want to focus on some of the kind of nuances that may be on the newer side that you may have heard about. So the first, just want to reiterate the importance of vaccines. We know that with people that have been fully vaccinated, that have gotten either the 2 doses of Pfizer and Moderna or the 1 dose of Johnson & Johnson, that it does wane. And especially with Omicron, it hasn't been as effective. But if you get a booster, which you can get it's 5 months after the initial 2 doses or 2 months after the Johnson & Johnson, if you do get boosted, you have extra protection. So we really encourage everybody, if you're not vaccinated, please get vaccinated. And if you are not boosted and you are eligible, that's the biggest way that you can protect yourself. Just a reminder too, that this is for anybody 5 or up. So we have vaccines for ages 5 and up. There's studies that are being done right now for under age 5, but those are not available yet. And so we're hoping that'll come out soon. But there are, as we talked about earlier, there's places where everybody can get those vaccines. The second is masking. So masks do work. We have learned that the Omicron is actually, that cloth masks are not as effective for Omicron. And so the recommendation is surgical masks. So that's kind of like these ones here, that they're the fiber, they have multiple layers. You can get them at Home Depot. There's lots of places you can buy them, but those have been shown to be more effective. And then you've probably heard about the KN95s and the N95s. So the studies have shown that those two types are marginally better or the same as surgical masks. And so if you have a surgical mask, then that works just as well. So you don't have to go out and buy the other types of masks. But I think the key piece is that you should find a mask that is not a cloth mask and that fits you well. So if you can't wear a surgical mask because it slips down below your nose, it's not going to be as effective. And so you should get a mask that does work for you. So moral of the story is, mask as much as you can, wear a properly fitting mask, and surgical masks and the K95s and N95s are more effective. Again, just to reiterate with the vaccinations too, with the vaccines ages 5 to 11, that's a new age group that has recently been passed, or the studies have shown that it's effective and has been approved for use. So a lot of people question, oh, COVID doesn't affect kids as much as it does adults, and thankfully that's true. So why do we need to do it? And I think the importance is that if we have something to protect our kids that's safe, then we should do that. And there are some children, especially those with asthma and lung issues, that are at higher risk and can be affected. And we know that across the country, there's pediatric ICUs that are full of children. And there are some kids that do die from this, unfortunately. But it's also the thing that we've been talking about this whole time, that you're not doing this just for yourself, but you're also doing it to protect other people. And so even though a 6-year-old child may not be sick from COVID, when they go home and they give it to their grandparent, then that person is at higher risk. And so it's still very important for us to reach herd immunity, and the children are an important piece of that. And the vaccines have been shown to be very effective and safe for that age range. And then the tried and true things of washing your hands. So sanitizing with alcohol or washing your hands for 20 seconds, that still works. That's very important for all illnesses, but for COVID included. We know that it is a respiratory droplet. So the masks are really what stops it, but having good hand hygiene also helps prevent infection. So just a reminder to continue to do that. And then the last thing is isolation and quarantine guidelines. So this is a hot topic that can get very complex and complicated. And if you're confused, it's probably because you've heard lots of different things from lots of different people. And I think there's the CDC that recommends one thing. The Massachusetts Department of Health actually recommends something a little different, and maybe your work or your school will recommend something a little different. And I think the main point is that if you have symptoms, please isolate yourself. Get tested and find out if you have COVID. So that's any cold-like symptoms. If you have a cough, a runny nose, a sore throat. We know with Omicron too that there's a lot of gastrointestinal symptoms. So having diarrhea or upset stomach, that also can be a manifestation. So the first point is, if you are sick, please isolate yourself and get tested. The second point is that if you are in contact with somebody, especially somebody that you live with, because that's where we see a lot of this passage happening, do your best to isolate that person and to isolate yourself and wear masks so that you can protect yourself from getting infected. A close contact is technically somebody who is without masks and for 15 minutes. And so I think a lot of people also get worried when they come in contact with somebody out in the community or somebody that they know. And if you're both masked and it's a short interaction, your risk is actually pretty low. So the higher risk is when you have masks off and you're with people, and that happens more at home when people are put their guard down and are around people that may not even have symptoms that can still give them COVID. So after that, there's a lot of different rules around how long you need to isolate, depending on whether you're vaccinated or not vaccinated. You can check out this information here. But I think the general principle is that if you have a close contact, you've been exposed, that we want you to isolate for at least 5 days if you are, especially if you're not vaccinated. So if you are asked to quarantine, that quarantine should be for at least 5 days. That's what most people are saying. And that means staying at home and trying not to be around other people. So there, like I said, there's a lot of variable things that you'll hear about this, but I think the general principle is that if you're sick, get tested. If you are a close contact with somebody, please isolate yourself and try to isolate from them, especially if you're at home, and follow the guidelines of the medical professionals that are recommending the guidelines that they are using.
Thank you so much, Dr. Vandenberg. That's incredibly helpful. We have that table there summarizing the quarantine isolation guidelines that Dr. Vandenberg just presented that we will also make available. I just want to thank all our panelists for all their insight and for participating and all their help tonight and over the last coming up on over 2 years. I would like it now to bring in our outreach director, John Hanna, who's going to help us in facilitating the question and answer portion of this evening.
Thank you so much, Mayor Nicholson. I'll start with the first question. The first question I think was already answered, but just to reiterate, are we going to be given a vaccine card mandate?
Yeah, thank you. So no, we're not doing the vaccine passport at this time for the reasons we talked about. We did consider it. We appreciate everyone who reached out with their feedback and the dialogue that we had with the community. As our vaccination rate continues to increase, our focus is going to be on building on that and continuing to monitor the deployment, the developments of the Omicron. I think what's really important is that this is an ongoing pandemic that we're going to continue to monitor. So that's a tool that we will have on the table that may be something that we need to be doing. And we're going to continue to take other important measures in the meantime so that we're prepared. And while we have some encouraging information about this current variant, we understand and expect that there could be future variants, and that is going to be something that we continue to monitor and continuing to really factor into that kind of decision making.
Thank you, Mayor Nicholson. Many people do not have insurance or are struggling to find PCR testing. How can we reach those more vulnerable populations?
Hi, it's Michele. PCR testing is free. So those who don't have insurance, you can go to the, there was a slide with the testing sites that were available in Lynn, but the PCR testing sites are free. There is no charge to you. So you should be able to get that. If there are problems with going to the sites, if you want, you could just call the health department, at City Hall, and we'd be happy to bring you the rapid antigen tests that I have to stress, we do not have tests at the moment, but we are happy to try to help any way we can.
Thank you, Michele. Yeah, absolutely. I think that's incredibly helpful. And I think for folks that are on this forum that are aware of people that are having access issues, we're working really hard to provide that access. And we've worked with our partners with the MGB, with the Community Health Center, with North Shore Community College and the state to make available these free options at different hours. And so part of what I think we're also working on is making sure that information is out there and available so that folks know where they can go. And then if there are other obstacles, if mobility issues or things like that, we're happy to, as a city, we're happy to work with our partners to help people overcome those obstacles. And so it's a great question, and one we're really committed to delivering is that level of accessibility. So thank you.
The next question is the Blossom Street testing site closing? If so, is there a plan for another site?
Do you want me to do that, Mayor Nicholson, or do you want to?
Sure, yeah, go ahead. No, go ahead.
The Blossom Street site at this moment is open and will be open until March 31st. And there's always the possibility of an extension, and there are other testing sites around. So at the moment, it is scheduled to close, but I do foresee an extension.
Thank you, Michele. That's certainly something that we are working on, and we are working on delivering these different channels of accessibility so that we can continue to make sure that people are able to get tests, because the vaccines and the tests are going to be what gets us through this. So thank you.
Thank you. If I get tested outside of Lynn and test positive, does the City of Lynn get that data?
Michele again. Yes, we get notified from the MAVEN system, which is the Massachusetts immunization system in Lynn, and we are notified of all Lynn residents, no matter where you test, where you test. The health department in Lynn does get the information. Yes, we do.
Thank you. Some parents are wondering about this vaccinating their children. What information do we have on that?
And I think, John, that's along the lines of how parents should be thinking about making that decision in terms of the having their kid get vaccinated. Is that right?
Yes, that's right. The pros and cons of
right.
Vaccinating their children.
Maybe we can turn this over to one of our esteemed medical colleagues to field.
From the numbers, we see that many doses have been given and have been shown to be safe. It is out of testing phase, and that's why the EUA approval was given. And we have not seen any significant side effects in large numbers any more than we do with any other vaccine that is out there. We do know that it does significantly decrease symptoms when people get COVID. There is still the possibility of people catching it, particularly with this Omicron variant, but the seriousness of the illness was much decreased. And one of our concerns is that it was noted that I believe it's the 5 to 11 range, and Lynn had only 30% vaccination rate as opposed to Marblehead, which has a 90% vaccination rate of the same age group. So there's a little bit of a lag, and kids in Lynn demographically have a little bit of a higher risk, and that what's shown for to be a risk to do much more poorly with COVID in kids is being overweight and having asthma, both of which have higher rates in the community. So that is a concern that we want to make sure that the kids are protected as much as is possible, just like we recommend for every other vaccine to help protect kids from illness. Even though rates of other diseases could be low, such as measles, we still recommend this because we know that if caught, it could go very badly, and we would always want to protect kids from those kinds of possibilities.
And I'd like to add, I mean, as a father myself, I have a 8-year-old and a 6-year-old, so I had to make the decision myself. And I was actually very excited to give my kids the vaccine. There's very few things out there that we have to combat COVID right now. I mean, there's certainly more things coming along, but the vaccine to this point has been shown to be very safe, very few side effects, and been quite effective to protect people. And I actually sleep better knowing my kids going to Lynn Public Schools and having been vaccinated now. That helps. And it also changes their absenteeism. So if you are vaccinated, it also affects when you've been exposed, how long you have to leave school. So there's some benefits in being able to keep your kids at school if you get them vaccinated as well.
Yeah, this is Dr. Lambl. I'd just like to add on to what's been said about vaccinating kids. I mean, there are 3 advantages to getting the kids vaccinated. First of all, the kids won't get as sick. Right now, 2 million kids in the United States have gotten sick with COVID, and believe it or not, some of them have died. Some of them have been in the ICU and have died. So we want to protect our children for sure, and make sure that they don't wind up in the hospital. But we also, you know, kids have suffered during the pandemic. As parents, we all know that they weren't able to go to school, they weren't able to participate in athletic events or to even have play dates. And this, by vaccinating them, you have that assurance that they can safely participate in activities that young children need for their own growth and development. And then finally, you know, Dr. Van der Berghe did say this, and I think it's worth emphasizing. Here at Salem Hospital, we are really overwhelmed with the number of cases that we have. Right now, we have almost 80 cases of COVID in the hospital, and half of the ICU is full of COVID cases. And many of these, I would say, in my experience, when I ask people how they think they got it, it's from family members. And we know that children can transmit to their grandparents, their parents. I've heard of families where both mom and dad were out of work, and brother and sister were sick at the same time. So it's also an effort to prevent the transmission and to shut down the virus from mutating. So I think this really, it benefits not only the child itself, but the family and also the community.
All right, just a few more questions. I've gotten all my shots and my family has gotten vaccinated, but we have a family member who does not want to take the vaccine. What are the risks of interaction, or what should we do?
Wasn't sure if Dr. Lambl was taking that. For the most part, we've recommended to avoid close contact with those who are not vaccinated and have a higher risk. There are lower risk activities that can happen, more so in the summer, not so much in a New England winter time, with being distanced and being outside and not being in a closed room. With those, I would say that I believe that most of us in the field who have been vaccinated do try to avoid those who are unvaccinated, just because of the risk of breakthrough infections. So I think that's kind of the answer there. It's hard when it's close family and deciding how to handle that. I believe it led to quite a few tense conversations with quite a few families over the holidays. You know, I know quite a few people who opted not to spend time with family members. Medically, that is our recommendation. And it's about finding that balance.
Yes, I agree. I think you have to keep your distance from them, and let's not forget that sometimes you can convince a person who's hesitating, who has vaccine hesitancy and doesn't want to get the shot, but they want to, you know, be with family, especially around the holidays. And so I've heard of cases where just in order to participate in important family occasions like birthdays, anniversaries, you know, holidays, they will get the shot just for that reason. It sort of pushes them to take that step.
So this is Dr. Haptu. Can I just add one more just caveat? What it is that, so here we have a disease that has killed millions and millions of people. And let's not forget people, you know, suffering from long COVID or complications of COVID. Quite a lot of them are out of work and disabled. And so, however, other vaccines like measles and polio that we've never seen really in a long time, we religiously vaccinate our children to protect from that disease. So, but we have seen the carnage of what COVID does. And so I just don't understand why our hesitancy is to prevent ourselves or protect our family from this bad disease. And I think the more vaccinated we are, we lower the risk of it being, you know, mutated and becoming more either aggressive or more, you know, similar to what Omicron says. We don't even know if there is going to be more variants coming up. And so, of course, there is what we call mathematical modeling, which people can predict or scientists can predict what would happen next. And so there is a prediction that probably there will be more variants. But I think by being meticulous in our social distancing, wearing masks, and getting vaccinated, we can avert that. So my message is, please, let's get vaccinated.
Thank you. Staying along these same lines, are children able to receive boosters yet? If so, are they available at any Lynn locations?
Sure, I can field that one. So, in order to get the booster, you have to be 5 months removed from completing the 2 doses of either the Pfizer or the Moderna, or 2 months after the Johnson & Johnson. The only one that has been approved in children thus far is the Pfizer, and so it really only applies to that one. And the authorization for children has only been around for more than 5 months for those that are in the adolescent range, so for 11 and up. So there may be a few that are eligible and they can get them at all the same vaccination sites. But for those that are from ages 5 to 11, it's still too early to get that. But they are still protected, because we know if you're immediately after you're vaccinated, you still have high levels of antibodies, so there's protection. The booster is there because of the waning of the vaccine over time.
The booster is also available at City Hall and the health department during the clinics.
Thank you. Many testing options require you to make an appointment online. Seniors without computer access are having a difficult time utilizing those options. What other options do our seniors have to get testing?
I'll speak to part of it, and I'm sure one of the physicians will speak up after. So for any senior, I think that was Pam who sent that. I read that. For any senior who does have issues or doesn't have a computer and needs to get tested and is able to go to a testing site, the health department is more than happy to register you online to set you up an appointment. Also, if you have a rapid antigen test at home, they could do that also. But if you want to call the health department, we are happy to try to register somebody online to get an appointment.
Thank you, Michele. I just wanted to jump in on that for the rapid antigen tests. You know, understanding the issues that folks can have with accessibility, particularly seniors with mobility issues. That was a big driver of our decision, working with the city council to procure a new supply of antigen tests that we can work to distribute. And the city, the public health department, will be working with our community partners to deliver those tests to prioritizing folks with those kinds of accessibility issues, so that we can get those in their hands.
This is Barb Lambl. I'd just like to add that there is a phone number that you can call to schedule testing at Project Beacon, and I'll give it to you right now. It's 617-741-7310. I'll repeat that, 617-741-7310. And they do ask that you call ahead to schedule an appointment.
Thank you. And this is our last question of the evening. Is there any information or data related to the rate of reinfection for those who have already had the virus? Does that get reported differently? What is there any information regarding people who have been infected and getting reinfected?
The
I'm sorry.
information, Dr. Valdes, go right ahead.
No, go ahead. I actually was needing the question repeated because I wasn't quite following it.
It's just about information of residents or who have been reinfected with COVID. So
I can restate the question as well, if that's helpful.
Yes, please.
Do we know anything about the rate of reinfection for people who've had the virus once before?
I can say I haven't seen any specific data on reinfection. I could just say anecdotally that I am most definitely seeing patients that were infected last year becoming infected again this year. The ones I have seen have all been unvaccinated. And I think they had thought that the immunity from the first infection was going to carry them through, and that they would not need any vaccines. So I have seen that happening in a handful of patients. But I haven't seen specific numbers. I think those numbers are getting a little bit harder to decipher with the home testing because it's not all getting reported in. And I don't know if there's any other data from like Lynn Community Health.
We also, I'm sorry, it's Michele, Dr. Valdes. We don't have specific data, but we do come across them during our contact tracing, when we do contact tracing. And Maven, the system that the state uses to report cases, if it's past 90 days out, they report them as a new case. So there really isn't any specific numbers that we're able to, percentage rate that we're able to give, since if it's more than 90 days out, they do count them as a new case.
Thank you. That's all the questions for now.
Thank you, John. I also just want to thank all our panelists, Michele Desmarais from the Public Health Department, Dr. Vandenberg, Dr. Haptu, Dr. Lambl, Dr. Valdes. Thank you all so much for joining us and for sharing your insight and expertise. Thank you to everyone who joined this evening. Thank you to everyone for all your questions. You can please continue to follow our Facebook page for more information. Facebook, Twitter, Instagram. The City of Lynn has a COVID resources page on the website, lynnma.gov/COVID-19/resources. Another way to stay informed is the city's Smart 911 alert system, which you can sign up for by going to smart911.com. This is an important moment for the city because we are still in the middle of the pandemic, and we are also hopefully starting to see some light at the end of the tunnel. And I want to just thank everyone in the community that has sacrificed so much over the last 2 years. The families who've lost loved ones, all our essential workers, our healthcare workers, for all that you do to keep us safe. The people on this this call, the work that they've done, and their teams. Previous administration under the leadership of Mayor Berghe, who have helped us weather this so far. We're still working. We're still in this. We're still pushing to keep everyone safe. And we recognize that the toll that this has taken on everyone, the public health toll, as well as the mental health toll of what we're asking folks to do, what we're asking businesses to do to continue to work with us. That's one of the reasons why we asked the City Council to approve, and they approved a new assistance program for small businesses who have continued to struggle from Omicron, from the hiring and staffing issues. That's going to provide grants through EDIC Lynn of up to $10,000, depending on need, for small businesses up to 25 employees, with priority given to minority and women-owned businesses. It's why we are working, really closely with the Lynn Public Schools team to keep our schools open, keep learning happening, and keep everyone supported and safe. I just want everyone to know that we are constantly reviewing these numbers, talking to the folks that have developed this expertise, and thinking about the trade-offs that we're asking everybody to make, to continue to make every day after a very long 2 years. And we're incredibly grateful for everybody's help in that. And we know this is a tough issue. It's clear. You look around the country about the kinds of the reactions that this is generating, and we understand that there are those reactions right here, and we create these forums like this evening as a way to hopefully give our best answer to those questions, our best good faith answer to those questions, so that we can show you what we're thinking and what we're feeling. And you are members of this community. You were before the pandemic. You're going to continue to be members of this community. And we understand this is a difficult time, and are as optimistic as we are about the light that's at the end of the tunnel. There's a lot that we can continue to do to make that a reality by continuing the vaccination efforts, to follow the isolation and quarantine guidelines, to keep our family and friends and coworkers safe, and to continue to pay attention to the masking protocols and the best practices as we understand them. And we will continue to make our best effort to make you aware of that guidance. So again, thank you all so much for your participation this evening. And please continue to reach out with your thoughts or questions. Thank you so much.
Good night.